Good evening, everyone, and welcome to the next edition of the virtual town hall series presented by the College Park Sandy Spring, Maryland Alumni Chapter. I'm Paul Bias, and I am happy to be your MC for the evening, and I will be facilitating the presentations and the discussions. Tonight, we have a great program. We're going to be talking about oral health and hygiene, and we have two dynamic presenters. Both are dentists. We have Dr. Barbara Gray and we have Dr. Ron Taylor. And first presenting will be Dr. Barbara Gray, and I will turn the presentation over to her at this time. Barbara, the floor is yours.
Thank you, Paul. Good afternoon, good evening. My name is Dr. Barbara Gray, and I am a practicing general dentist in Southern California. Thank you for inviting me. Just to tell you a little bit about myself, I am a native of Washington, D.C. I attended the American University for undergrad, and I attended Howard University for dental school. I've been practicing in Southern California with my husband, Dr. Robert Gray, for the past 21 years. My husband, he very much wanted to be here today, but he did prepare a presentation on racial disparities in oral health, which I will share with you. I'm also happy to be joined by your very own Dr. Ronald Taylor, who will also be presenting. And at the end of his presentation, we will do a Q&A. Share my screen.
How's it working?
I can't share my screen.
Okay, give me 1 second. Try now. Perfect.
Good evening, everyone. My name is Dr. Robert Gray, and I'm a dentist here in Southern California. I want to take time to thank you for allowing me to talk to you today and bring you a subject that I am very passionate about. I first have to apologize for not being able to be here in person, but I want to thank my more than capable colleagues, my wife, Dr. Barbara Gray, and my colleague, Dr. Ronald Taylor, who will be helping facilitate the slide deck and answer any questions that you may have. What I want to talk to you about today is a little more than just brushing and flossing. I'm sure many times you've heard that the lack of brushing and flossing leads to tooth decay and gum disease, but today I want to take it a little bit farther. I want to talk about how the lack of good oral health can cause other health problems and convey some information about racial disparities in public health. When we talk about oral health, the first thing we have to understand is that there is no way to separate the mouth from the rest of the body. The mouth is the primary way in which all things enter our body, both good things like food and water, and bad things like viruses and bacteria. So when we talk about healthcare and keeping ourselves and our bodies healthy, we cannot separate the mouth. Unfortunately, in the United States, we have allowed oral health to be thought of differently than overall health. In our healthcare system, in the training of our healthcare professionals, and in our insurance model, it has been separated. Less than 15% of adults in this country understand that oral disease has proven links to many other healthcare problems. How many of you knew that men with gum disease have a much higher risk of developing cancers? In the next slide, we'll go over some alarming statistics. Men with periodontal disease, or better known as gum disease, are 49% more likely to develop kidney cancer, 54% more likely to develop pancreatic cancers, 30% more likely to develop blood-related cancers such as leukemia, lymphomas, and myelomas. The reason why this is true is still being studied, but these numbers are very alarming. And it's not just cancer. Studies have found many diseases and many health problems are seen way more often in individuals with poor oral health and gum disease. In the next 2 slides, we'll talk about just a few of these related health problems. Diseases that have been linked with poor oral health include endocarditis. This is an infection of the heart lining caused by bacteria from other parts of the body, including oral bacteria. Another is stroke and cardiovascular disease. Although the link is unproven and unknown, research suggests that inflammation and infections caused by oral bacteria is contributing to higher incidence of stroke and cardiovascular disease in those with poor oral health. Gum disease is also known to correlate with both premature births and lower birth weights. Other diseases that have shown relationships to poor oral health include pneumonia, asthma, diabetes, and unfortunately dementia and Alzheimer's disease. All of these occur at an alarmingly higher rate within the African American community. For the second half of this presentation, I want to talk about why this matters to us. When it comes to preventive medicine, preventive dentistry, and even treatment, African Americans experience alarming health disparities compared to any other ethnic group. Although the causes of the disparity are complex, the reasons include poverty, racism, and discrimination. I will now highlight some alarming statistics. 29% of Black Americans report seeing a dentist in the past year compared to 55% of white Americans. And this is just the beginning. The average child gets their first adult tooth at 6 years of age. Therefore, it is important that we teach our youth healthy oral hygiene habits, so as they age, they will have healthier mouths and healthier bodies. Currently, 28% of African American youth ages 2 to 5 years of age have untreated dental cavities, while their white counterparts, only 18% have untreated dental decay. Traditionally, this has been due to a lack of access of care within our communities, the high cost of dental treatments, and the lack of dental insurance. But now, thanks to the Affordable Care Act, also known as Obamacare, every American youth under the age of 18 has access to affordable dental coverage. So in the near future, we hope to see this statistic improve. But for many of us from previous generations, the lack of access to care and untreated decay has led to pain and tooth loss as adults. So by now, you're probably not surprised to learn that African American seniors suffer total tooth loss at more than double the rate of white Americans. And to make matters worse, after retirement, many Americans find that their dental insurance has ended. So again, the reasons for the disparities are complex, but I would like to share a few. They include the lack of access to dental care within our local communities, the increasing cost of dentistry, the lack of oral health education within our community, and systemic discrimination and racism within our healthcare systems. We need more healthcare professionals that look like us, that come from our communities, and who share and understand our culture. Currently, out of the 200,000 practicing dentists in the United States, only 3% are Black. Again, the reasons for the disparity. You may be asking, what can you do? And you can really help in 2 basic ways. 1, share what you have learned here with others, with your family and your community. And 2, understand that regular dental visits are vital for your overall health. They are designed not to only treat disease, but to prevent disease. And of course, I can't end today without talking about brushing and flossing. There are 3 easy things that you can do to decrease your chances of developing cavities and gum disease by up to 80%. The first is to use an electric toothbrush, such as Sonicare or Oral-B. The second is to use a daily fluoride mouthwash, such as ACT or Listerine Total Care. And the third is to floss daily. If we all just did these 3 things daily, we would see improvements not only in our mouths, but in our overall well-being. So I hope you now understand that oral health disparities in the Black community are important because they can lead to a number of negative consequences, including increased risk of tooth decay and gum disease, difficulty eating and speaking, pain and discomfort, social isolation, decreased self-esteem, increased healthcare costs. And these disparities are often due to a number of complex factors. They include lack of access to dental care, to the cost of dental care, the lack of education in our communities about oral health, and discrimination in the healthcare system. But there are a number of things that can be done to address oral health disparities in our communities. They include increasing access to dental care, providing financial assistance for dental care, educating people about oral health, and by addressing discrimination and systemic racism within our healthcare systems. By taking these steps, we can help to ensure that all people, regardless of their race, ethnicity, or other factors, have access to the oral health care they need. And with that, I'm unsure if Dr. Gray or Dr. Taylor would like to add anything, but I do know they will be more than happy to address any questions that you may have.
All right, thank you for your attention. And I'm going to turn the floor over to Dr. Taylor and we can answer any questions, or I don't know if you want to add anything.
Yeah, I could add a couple of things. I'd like to introduce myself to those that don't know me. I'm Dr. Ron Taylor. I'm a native from the Bronx, New York, and went to undergrad at Stony Brook University. And then from there, went to dental school, University of Maryland, and also class of 1996. And I know Dr. Robert and Dr. Barbara Gray, both crossed each other's paths. We did a lot of stuff together, down the street with Howard and University of Maryland. So, we got a lot in common and know a lot of the same folks. And then I went on, I'm an endodontist. I'm a root canal specialist. So I did my training at Case Western for endodontics and been practicing for about 23 years as an endodontist in the DC, Maryland area. Doctors Gray, Robert and Barbara Gray did a phenomenal job talking about health disparities and some of the reasons why it's important to take care of oral health. I have a presentation that has a lot of similar things. I'll just add a couple of things, some really good information that I actually learned along the way from doing this presentation. That were actually in some notable journals, and they contribute to some of the reasons why we have some of the racial disparities that we're seeing today. So I'll talk a little bit about that, and then we can go over a little bit of Q&A at the end and take it from there. All right, I'm just going to share my screen. And all right, so I just like to go over a few things. Can everybody see my screen?
Yes.
Perfect. All right, excellent. So we'll just go over like our introduction, some primary goals, oral health care in the Black community and how it affects us as a people, and then the importance of good dental health, and then we'll just go over our summary. And when we look at oral health, we want to go over some of the factors that contribute to disparities in dentistry and taking care of our teeth and why it's so important. And then also, I wanted to talk a little bit about the dental IQ and how we can increase our dental IQ, get that up. It's a good thing to ask questions if you never know, and just some of the things that we've already gone through in these town halls is don't be afraid to ask questions to your doctors. The more information you know, the more questions you ask, the more engaged you are with your own health, the better off So our primary goals are just really to kind of bring an awareness to some of the disparities that we already know are there, they're present. Discuss the importance of good dental care, and we talked about the dental IQ. So when we look at the factors that contribute to racial disparities, we know that it's a multi-dimensional problem. It's not just one thing that causes these disparities. We already talked about systemic racism, and then there's unconscious bias that's there. And the thing about unconscious bias, whether people realize it or not, African Americans, we are still at the end of that. Whether it's deliberate or not, we still suffer. Inadequate access to care, cultural traits, and then socioeconomic factors. So non-Hispanic Blacks, Hispanics, and Native American Indians and Alaska Natives generally have the poorest oral health of any of races and ethnic groups in the United States. African American adults, however, are more likely than any other racial or ethnic group to have periodontal disease. And compared to whites, African Americans are more likely to develop pharyngeal cancer and less likely to have it diagnosed at early stages. And they'll also have a lower 5-year survival rate. Racial and ethnic minorities in general are also more likely to be uninsured and not have insurance, and then just not have great access to dental care. So this is a study in 2018 about systemic racism, and this is in the Journal of Dental Research by Bastos. And the interesting thing about this study is they took skulls and they looked at some historical studies, from the 1800s, and they were trying to figure out why do we have some of the problems that we see? Why are we having racial bias in oral health care? And when they looked at some older studies, they found some things that were just really, really alarming. And these were studies that were done. This study was done in the Lancet in 1851. And in this study, they took a bunch of skulls, and they were studying skulls from all over the world. And they had some skulls that they referred to as barbarous tribes, skulls from barbarous tribes, barbarians. And then they compared them to skulls that they considered to be civilized men. Well, go figure. The barbarous tribes were basically skulls from African tribes, African nations, and the skulls of civilized men were Europeans. And they compared these skulls, and they found some stark differences in these skulls. But the result of that was a bias. And that bias was something that just could not be undone. So in addition to that, there was also a biological bias that occurred. And with that biological bias, they looked at Africans and they compared them to whites, and they came up with their own conclusions, without really taking into account some of the other contributing factors that may have skewed some of the findings that they had. And then there were also psychosocial stressors that contributed to unequal distribution of mistreatment. And some of those things just gave rise to certain patterns of oral health care and racial inequalities in dental outcomes. So you have your psychosocial stressors that really also contributed negatively. Inadequate access to care. And some of these things would include poor nutrition, drinking water that's unclean and non-fluoridated. And we all know about what took place in Flint, Michigan, and also in Jackson, Mississippi, where water was just unclean. And unfortunately, some of these things have happened they happened in areas where they're predominantly African Americans. there are also limited dentists in some of these areas, the rural areas where there are predominantly African Americans. There's just not a lot of dentists in there. The ratio of dentists to patients is very poor. Unlimited facilities and supplies, and then also limited transportation where people just can't make it into the dentist. And then there's cultural traits. So when we talk about cultural traits, we're looking at traits that negatively affect patterns and reasons why people go to the dentist. And a lot of these are historical: lack of trust in going to the dentist, and then views of the benefits of preventative dental care. And I know we've all heard it. Hey, don't go to the dentist. I don't go to the dentist unless it hurts, and we hear that all the time. And the value in maintaining and saving a natural tooth. I'm a root canal specialist, and the thing I do is root canals. And root canal, for those that don't know, a root canal helps you save a tooth. And so many people come in and they just want to pull the tooth. And my job, I feel, is I have to try to educate people and try to, once again, increase that dental IQ and try to explain to them why it's important for them to save their natural tooth. But it's a cultural thing with African Americans. Hey, let's just pull that tooth. Well, my grandmother, she just pulled her teeth, or my uncle, he just pulled all his teeth and he's fine. If it hurt, he just pulled it. And that's cultural, and we've got to get away from that. Cultural philosophies on extracting teeth, dietary habits, oral hygiene behaviors, and then our expectations on oral health. What are our expectations on oral health? And then the socioeconomic factors are also something that plays a role in the disparities. However, socioeconomic factors, they found, were less likely to be a major player in contributing to these disparities. So if you had, for example, people who made the same amount of money, had the same level of education, would there still be disparities? And the answer to that is yes, there would still be disparities. If everybody was rich, everybody had high level of education, there would still be racial disparities in dentistry. And they did a study and they found that poor Hispanics, they got a group of people, all poor people, below the poverty level, and Hispanics had a level of caries of 47.2%. Black adolescents had a level of 43.6%, more than twice the proportion of untreated tooth decay than white adolescents, who was only 20.7%. And these are all poor, below the poverty level patients. So socioeconomic factor plays a role, but not a huge role. So why is taking care of our teeth so important? And I know Dr. Barbara and Dr. Robert talked about it. But when we take care of our teeth, we can chew our food better. And when we can chew our food better, we can digest our food better. And that prevents the development of oral diseases like cavities and gum disease. And then it promotes overall systemic health. So I'm just going to run down just 10 benefits of good oral health. And I know we've heard some of these, but lower risk of heart disease, and heart disease is the leading cause of death in men and women in the United States. And if the bacterial infection in your mouth enters into your bloodstream, it could also build up in your arteries. This buildup leads to a condition called atherosclerosis. Okay, and we know that's a serious form of heart disease. Reduced joint inflammation. Okay, rheumatoid arthritis develops when you have inflammation in your joints, heart and blood vessels, and other body systems, and the oral bacteria can introduce inflammation to your entire body. So the thing we're always trying to reduce and eliminate, when we take care of our mouth, is reduce and eliminate inflammation. There's a lot of bacteria in the mouth, and if we know we can reduce the amount of bacteria and keep it clean, it's going to reduce inflammation that can be introduced to other parts of the body. Healthier pregnancy. Both mild and severe gum disease is directly linked to pregnancy risks like low birth weights and early deliveries. Okay, researchers suspect that the body naturally fights the bacteria in your body, and that may also lead to premature labor. Improve sexual performance. All right, guys, ignoring your teeth and gums can lead to erectile dysfunction in men. All right, good reason to brush. When gum disease bacteria enter the bloodstream, it causes inflammation in your blood vessels. As blood vessels become inflamed, the blood flow to your genitals declines, affecting your ability to get or sustain an erection. So very, very important. Better respiratory health. Your bloodstream isn't the only way bacteria enter your body. Every time you breathe, bacteria go directly to your lungs. Okay, and now it's in your lungs, or bacteria can increase your risk of respiratory infections like pneumonia or bronchitis. Minimize risk for certain cancers. And we talked about some cancers earlier, but gum disease increases your risk for all types of cancer, especially cancers of the blood. And these increases may be due to inflammation in your body, and that's caused by oral bacteria. Improve fertility. Not only can periodontal disease cause fertility issues in women, it could also negatively affect fertility treatments. Okay, this is likely due to impact gum diseases that has on hormones, progesterone and estrogen. Protection for your brain cells. Okay, so the bacteria in your mouth aren't the only danger associated with gum disease. If you have tartar buildup, your mouth also releases substances that kill your brain cells. Combining this with oral bacteria entering your nerve channels and bloodstream, your risk of Alzheimer's disease and memory loss also increases. Lower your risk for kidney disease. Not only can oral bacteria lead to chronic kidney disease, it could also increase the risk of death in older adults who already suffer from the same condition. And then the last one, number 10, reduce risk of diabetes complications. And we talked about diabetes. We know if you have diabetes, having gum disease makes it harder to manage your blood sugar levels, which can make diabetes even more difficult to control. And if your periodontal disease is more advanced, you might also experience increased blood sugar production. And then it's like a cycle that occurs. I mean, if not taking care of your oral health can affect your diabetes, your blood sugar, and your diabetes. And then once you have diabetes, it makes it even more difficult for healing to take place. So now you have a cycle that continues, and both make each worse. So in summary, disparities in oral health are deeply rooted in systemic racism. Socioeconomic status is a contributing factor, but there's much more that affects disparity in the Black community. And we talked about some of those things. And then it's important to understand the benefits of having good oral health, become proactive in taking care of your teeth and your gums, and educate yourself and raise that dental IQ that I was talking about. Understand some of the things and the terminology that your dentists are talking about. And don't be afraid to ask questions. The higher your dental IQ is, the more value you're going to place in taking ownership of your own dental health, and the better off your health is going to be in the long run. All right, thank you. All right, so I'll stop there, and if we have any questions, myself and Dr. Barbara Gray could go ahead and answer some questions for you. And were there any questions in the chat? We could do it that way. If somebody wants to do a raise of hands, to raise their hands the icon, we could take some questions that way as well.
Well, thank you for that. And we really appreciate both Dr. Gray and Dr. Taylor. Excellent presentations, as always, excellent information. There are questions in the chat, and I will kind of go through and pick those up. For everyone else, if you have a question, I'll ask that you use the reaction icon and raise your hand, and then we will take questions in that order. I do see a question in the chat, and the question is, when flossing, which is more effective, string floss or an electric water flosser? And either doctor or both doctors can entertain that.
Oh, definitely a string flosser is more effective. Electric water flossers, they are a good aid, but definitely the string flosser will definitely get rid of the material that's between the teeth for sure.
Okay, Dr. Taylor, anything on that, or want me to go to the next one?
No, I would totally agree.
Okay.
String floss is definitely better than water pick or water flosser. Yeah.
Perfect, perfect. So the next question is, are there tips specific for kids or young adults around oral hygiene, brushing, flossing, that sort of thing?
Well,
Dr. Gray.
just like we said in the presentation, brushing regularly. I do recommend using an electric toothbrush. I prefer Sonicare over Oral-B. Sonicare seems to simulate a regular toothbrush, but you're definitely getting more repetition with that as opposed to Oral-B, which does more of a circular motion. They both will be effective, but I recommend to my patients Sonicare. Brushing regularly, brushing twice a day, flossing once a day, and using fluoride rinse definitely will help prevent cavities, which is key for children to prevent them getting cavities.
Yeah. One thing I would also add to Dr. Gray's comment is that with these electric toothbrushes for kids, they have these timers, and those are great because you set the timer, and instead of kids just going in 2 swipes and they think they're done, they just think they just got to spread a little toothpaste on their front teeth and they're good. Nah, they got these timers in there and they can't finish until they put these timers in. And another thing that's good for kids, if you have a kid that really want to get them to learn how to do effective brushing, they have these the chew tablets that pick up some of the stain from the plaque, and you just have them brush with that. And we did it with our kids for a little bit so that they got familiar with that act of brushing, and they keep brushing until they get all of that plaque off from the stain from those chew tablets. So that helps also.
Yeah.
Awesome, awesome. Got a couple more questions. Before we go to the next couple questions in the chat, I'm going to interject. So we've talked about the type of brush, we've talked about flossing. Is there a particular technique? And the reason I asked this question is I had a dentist a couple decades ago who suggested to me that the most effective way to brush, and I believe at that time the water picks and all that stuff wasn't as prevalent as it is now, but he mentioned going from the gum line towards the bottom of the tooth. So you'd be brushing the top row down towards your tongue, and if you were brushing the bottom row, it would be up. So it's always from the gum line towards the edge of the tooth. Is that more effective? And if so, why?
I think it is an effective way of brushing. A lot of my young patients, they tend to miss the plaque that accumulates closer to the gum line. Just making them aware that you have to brush the gum line because sometimes they don't want to touch it because it doesn't feel good. I think that's the best way to do it, to make sure you're catching that area, because that's where you can get cavities even if you brush regularly. So definitely that's a very effective way of brushing.
Okay. So this is more, I think, of a policy question. Why do the insurance companies still limit dental insurance coverage, which even in middle income families causes limitations to access? And it's, I guess, not consistent with good dental practices. Any thoughts on that?
So if I understand the question correctly, it sounds as if they're asking, why do dental insurance companies limit some of the benefits that they have to certain procedures. Is that correct?
I believe so. And whoever asked,
Yeah, I asked a question, so I'll just clarify. Good evening, brothers, again. So what I was asking is, you talked earlier about insurance companies separating insurance out from healthcare, or Dr. Gray did in his presentation. And my question is, insurance companies typically keep separating dental from health. And even in their dental, even when I look at dental policies, there's a lot of things that are limited that you can't get, or it's limited by amount. So even a middle income family can't get access to good dental care because if they're using insurance as their primary source, those policies are so limited that it doesn't allow them to do everything they need to do.
Yeah, I mean, the thing about dental insurance is dental insurance benefits haven't really changed a whole lot in the last 30 years. Premiums, they go up every year. You keep paying more every year. Your premium is going to go up 5% or whatever, but the benefits never go up. The benefits are always the same. You may have, a $1,500 max, a $2,000 max, but it doesn't change a whole lot. What it covers is very limited. And, I mean, with that kind of a benefit, I mean, what can you get? You might get, if you need crown and bridge work, you might be able to get maybe 1 crown, so it's really meant for like cleanings and some fillings, but it's not really meant for a whole lot of major dental work. And some people have good plans where they cover a little bit more, but still it's got limitations to what you can get. And that's just the way dental insurance works. It's very different from medical insurance, which is why they separate dental insurance from medical insurance.
do any of those procedures that you mentioned, crowns, and I can't remember what the other one was, would they qualify as medical procedures or only they don't? Okay.
No, they don't.
Okay.
Yeah, that's a good question. Yeah, they don't. Yeah.
All right. Next question. How does teeth grinding affect your oral and overall health?
That's a great question, because I see it every day in what I do as a root canal specialist. And especially here in the DMV, everybody's under stress. So everybody's grinding their teeth. It's called nocturnal bruxism. And a lot of people do it during their sleep and they don't realize that they do it. So it causes a lot of damage to teeth. It causes a lot of cracks in teeth, a lot of trauma to teeth, and people may need root canals. And crowns, eventually crowns, to protect their teeth. But the main thing that needs to be done is address the source of the problem, and that's the grinding. And there are things that can be done, like Dr. Barber can make you a night guard, and it's like an appliance that you could wear at night. It's a mouthpiece you wear at night that protects your teeth. It's not really, the problem is it's not really the most comfortable thing to wear. But it will help protect some of those teeth from trauma or cracks that can occur from grinding your teeth. Dr. Barber, I don't know if you have anything else you want to add. I know you probably see a ton of that stuff.
Yeah, the key thing is to find out the source of what's causing the grinding, because as he said, it can cause a lot of problems. It can cause malocclusion. It can cause problems with the joint, your temporomandibular joint, the TMJ. And as you grind your teeth, it can cause teeth sensitivity. So if we don't address what's causing it, it just tends to get worse, and it can become a very expensive problem as far as dentistry.
That's right.
All right. Well, thank you for that. Should children receive oral mouthwash as a procedure?
Oral mouthwash.
Yeah.
Should they use mouthwash? Is that what you're saying?
So if I believe the question came from Dr. Joe, if you wanted to add some context to that, that'd be great.
No, I was just following. I came in on the tail end of the recommendations, and I didn't know if it was just adults in that 3-part step.
Okay.
Okay. Yes, I mean, ACT Fluoride rinse is good for kids. It's just an addition to if they need it, if they have a high case of developing cavities. If they don't, then I would say just brushing and flossing is good.
And that's helpful. That's what I thought. Thank you.
All right. Next question, and thank you for that. Next question is, how do we get more Black and brown kids interested in dentistry at an early age?
Man, that's a great question.
That's a great question.
I feel like I really do as much as I could possibly do to try to attract young people who look like me to go into the field of dentistry, and it's just really difficult to get African American young people to become interested in pursuing a career in dentistry. I wish I knew the answer to that, but it's tough to do. Anything that we can do to inspire kids to pursue a career in dentistry, I think is the first step, and mentorship is very important, because I remember when I was trying to become a dentist, I felt like I just didn't have a whole lot of mentorship, and I wish I did. I had to kind of figure it out on the fly, and it would be so beneficial, be so great if we could have some young people who are interested, because the reality is the number of African Americans going into dentistry is already low, and the number that are going into dental schools, it's not getting much better. It's still really low. So if we could get some that are interested in dentistry, that would be great.
All right, so we have I'm going to do two more questions from the chat, and then we'll get to Brother Gladden. This next question is an interesting question, and it is, how safe is tooth whitening, whether it's over-the-counter whiteners or based on, I guess, a procedure by a dentist?
Okay.
What's the impact of the whiteners on the tooth?
Well, of course, the whitener you get done at the dental office is a professional strength, and it should be monitored by a dentist. I recommend that to my patients, but I have had patients who have actually had good results from using the over-the-counter whitening. I just make sure the patient understands that, be cautious when you're using it. The whitening can cause sensitivity, so make sure if you're doing it, you're monitoring if your teeth are becoming more sensitive, and kind of cut back on it. But I do recommend getting it done by a professional as opposed to over the counter. But they are safe over the counter.
Okay, thank you. Two-part question here, and then we'll go to Brother Gladden. Can you please explain the benefits of using a water picks for gum health? And then the second question is, what are some good toothpaste options? Either one, either dentist.
I don't know a whole lot about the water pick, Dr. Barber. I don't know if you want to answer that one. I mean, toothpaste, I kind of like using anything that has a fluoride-based toothpaste.
Yeah, definitely fluoride-based toothpaste. I'm pretty old school. I know there are a lot of dentists out there that every little gadget that comes into play, they want to recommend it. But honestly, simple brushing with the fluoride toothpaste and flossing is good. If you have a little bit of advanced periodontal disease, sometimes a water pick can be more helpful. But if you don't have a lot of, I'm sure you've gone to the dentist and your doctor said maybe you have bone loss. If you don't have a lot of bone loss, your teeth are pretty healthy, I would just recommend using just a regular floss versus a water pick. But if you have advanced periodontal disease, and a water pick can kind of help keep things clean in areas in which you can't reach.
What about peroxide additives? There's a lot of toothpaste brands that now have peroxide included in the mix. Any problem with that?
No, I mean, our parents back in the day, they were very inventive in how we did things. The peroxide does very well. I'll have patients come in and their teeth are very white. They've never had their teeth professionally whitened, and I'm like, they say, "Oh, I just brush with peroxide." So definitely follow the directions on the bottle, and you should be fine.
All right, thank you. Brother Gladden. Take yourself off mute.
Kind of goes with the toothpaste, fluoride. Uh, Dr. Taylor, I'm a longtime patient in my youth of University of Maryland Dental School. They use me as a guinea pig for many, many dentists out there in the state of Maryland and probably around and just all the things they do at dental school. I used to have the fluoride washes and mold with fluoride and fluoride toothpaste. And just a question on genetics and just the makeup of teeth and genetics of, I've been doing fluoride since I was a little boy, but I think I just have soft enamel, soft teeth. I mean, just last year I had to have a little filling done. And as you know, you discovered a major cause of my pain in my mouth. I had an undiagnosed cavity that was high and way in the back that was causing me a lot of problems that nobody kind of saw for whatever reason.
Yeah.
Just if you speak to genetics of teeth and just fluoride and
So it's a good question. So one of the things I do know about genetics is that you have saliva that has a particularly neutral pH balance, right? However, you can have saliva that is slightly more on the acidic level or just very slightly more on the basic level. And it can be hereditary. It can be hereditary, where if you have saliva that's a little bit more on the acidic level, you're more prone to getting and developing caries, tooth decay. And then you have some people, you look at them, they never get a cavity, and they may have saliva that's more slightly on the basic level. And those people, you look, they never get cavities, but they're more prone to building up tartar, and they're more prone to getting periodontal disease because they build up tartar very easily. So I'm a testament to that. My brother, my sister, we probably have saliva that's a little bit more on the basic side because we don't get a lot of cavities, but we are prone to periodontal disease, gum disease, and building up tartar very quickly. So, it's important for all of us to really get our cleanings done frequently because of that. But you see patients who their whole family, brothers and sisters, they're just rampant decay, and you're wondering, hey, what's going on here? So there's a little bit of that does come into play. Diet is a big factor too. So there are external factors, but as far as genetics, there can be a little bit of genetics that plays a role in that.
All right, perfect. So I think we have two more questions. One is, how soon would you have a child begin flossing? Is there a minimum age, I guess, to start?
There isn't a minimum age. Of course, flossing, it requires some dexterity with your hands. I would recommend that parents, start them as far as helping to create the habit. With baby teeth, they're a little more spaced out. So definitely I would have the parents go in probably, there isn't a minimum age, but I would probably start once they start understanding what's going on. So I'd say probably around, 2, 3, so they can just get in a habit of knowing that that's something that has to be done.
All right. And then the last question I see in the chat is top 3 ways to eliminate oral health disparities, if anybody wants to kind of entertain that. And the caveat is, especially since disparities exist after taking income into consideration.
Mm-hmm. That's a great question. I would say talk about dentistry, talk about teeth, talk about it. It just seems like it's something that people don't want to talk. Black people don't want to talk about teeth. We got to talk about these things.
Yeah.
We got to discuss it. And I think that's step number 1. we got to be open to discussing and talking about teeth and the value in saving your teeth. Why is it important for me to save my teeth? No, I don't want to get a tooth pulled. Are you going to pull it? No, I'm not going to pull it. I'm going to do what I got to do to save this. And we need to talk about that. Why? Because it's important to save your natural tooth. There's nothing man-made that can replace what God made. You know, it's there for a reason. Teeth are there for a reason. And there's nothing man-made that can replace it. You know, now if you can't save it, you can't save it. It's got to come out, right? It's got to come out. But if you can save it, don't pull it. You know, if you break your arm, are you going to cut your arm off? Of course not. You're going to try to fix it, right? You're going to get a cast and repair it. So we have to talk about these things, and we have to openly discuss why it's important to save our natural teeth. So I think that's the first step. Value, create value.
All right. So I'm gonna throw one last question out here. I know nobody on this call falls into this category because every time I'm on Facebook, I see all of them smiling in front of the camera. But let's say there are people who have not been to see a dentist in a year, 2 years. What's the first thing after getting an appointment? What should they be looking to do to make sure that they're on the right track? Obviously, get the dental appointment, obviously, you know, have their teeth checked for cavities and this sort of thing. But there were a lot of diseases and conditions that were mentioned that are a direct reflection of not having the proper oral care. So is there an order to how they should proceed if they now decide they want to, you know, start taking their oral health a little bit more seriously?
Well, the first step is getting into the dental office. As having a patient that comes in that hasn't been in the dental office for a while, my question would be why, and then trying to create a safe space or allowing that patient to have confidence in me to want to pursue having a healthy oral cavity. A lot of times, especially in my practice, I get a lot of new patients, and I think the fact that I make them feel comfortable, make them want to come back. I try to explain things to them in a way in which they understand. I think having a good relationship with your provider is key. Because unfortunately, in our profession, I don't want to say too much, Dr. Taylor, but we have some used car salesmen personalities that make people not want to come. So definitely, there is an order when you come into the dental office. If you haven't been, you know, in any dental office, you need to take care of the structures in which hold the teeth in there. A lot of people come in there worry about their smile, but I think it's important that you understand the overall oral health, which means you have to take care of the gums, you have to take care of the soft tissue, and you have to take care of any decay. You have to get rid of any bad or missing teeth. And then if you remove teeth, then of course you have to talk about replacing the missing teeth so you can have so teeth won't move around. So there's an order, but just I think the key is finding a provider in which you feel comfortable enough where it becomes a relationship between you and that provider, where you feel comfortable enough to ask anything and they feel comfortable enough to make sure that you're educated. Dental IQ is key.
All right. And Dr. Gray, refresh my memory. Are you practicing out of Los Angeles?
No, I actually practice in Upland, California, which is in San Bernardino County, which is right at the border of Los Angeles County.
Okay, perfect. We do have another question. For children, is it best to start with old school string floss, which takes more skill, or kid flossers? Does it matter for children under 12?
I don't if they're young kid flossers are probably good, but a 12-year-old, you want to start making sure they have adult habits. So I would say as soon as possible, start them using regular floss. And that will be basically kid dependent. You know your children, you know how they progress. So I would definitely start them on regular floss as soon as possible.
All right. Well, if there are no other questions, let's see. Hold on. Oh, here's a great question, and it wasn't covered. Is there a directory of Black dentists, periodontists, et cetera, that would allow somebody to find a provider of color?
That is an excellent
That's a
question.
great question.
Yeah, that's that's an excellent question. I don't know
Yeah.
of any in my area.
I don't know if the NDA has a directory on
Okay.
their website, but you could check the National Dental Associations, the Black Dental Association nationally, and they may have a link or a directory for some members if you're looking for a dentist in your area. That's possible.
And the good thing about social media now, I don't know if you notice, I probably because I'm a dentist, but I see a lot of the younger Black dentists. They're all over social media. So if you go to social media and put in Black dentist, you'll definitely find one. I'm a part of a group on Facebook called Sisters in Dentistry, and it's really good because sometimes when like somebody say if they're looking for a general dentist in DC, I can just go in and say, hey, I know someone who's looking for a general dentist in DC, and they want an African American, they want a Black, and you'll get tons of responses. So there's definitely a way to find us.
All right. Well, thank you so much again for our panelists. Again, Dr. Barbara Gray and her husband, Robert, who helped with the presentation, and Dr. Ronald Taylor. Before we end this evening, I want to take a moment and recognize a couple of our newest members. We have Julian Owens and Miles Whitfield, who are on the Zoom. So I just wanted to give you all a shout out. Thank you for joining. And I also wanted to give our officers is our first vice Mark on. I think Mark Ellington was on, but he had to get off. So I just wanted to
I'm
give,
still on.
okay, perfect. I'll give you the floor for a minute, sir.
Yeah, and actually, yeah, Dion is still on too. So thank
Yeah.
you to our first vice Mark as well. I was gonna have to get off, but once again, brothers, this is enlightening. My aha from this was about the hereditary saliva, because I never get cavities, but I've had issues with gum, and so and I always wonder why, because people are like, I eat jelly beans every day, and people wonder why I don't get cavities. So now that I know, so every time that we get on these calls, there's got to be an award for this series of not just oral health, but all the ones we've done. And just appreciate the panelists, Dr. Gray, and your husband. Thank you all for the presentation. Dr. Taylor, as always, thank you for being ever present. Let's have some special prayers out for brother Dr. Joseph as well. He buried his mom today. I talked to him earlier. So let's definitely keep those prayers going for Dr. Joseph. But and of course, let's not forget brother Paul Bias, who has taken up the cross of leading this at the beginning of our administration, and has taken this to lengths that I couldn't imagine, along with his committee with Dr. Taylor and Brother Gladden and Brother Joseph. So please keep doing these, keep bringing this on. It's great information for our brothers, and at some point in time for someone else who may get it passed on to you too. So thank you.
Absolutely. And it's always a pleasure to be with you all. Thank you for all of the thoughtful questions. Thank you for your participation. And we look forward to our next session. Brother Gladden, correct me if I'm wrong, it is May 9th, and we will be talking about the importance of the annual physical. As always, if you all know of physicians who could serve the community by being a part of this, we'd love to have their contact information. Please feel free to share the recordings. I always make those available within the next 24, 48 hours after our town hall. And again, we ask that you all be well and be safe, and thank you for participating. And with that,
Someone asked a question. Someone asked another question about an adult toothbrush versus a child toothbrush. When do you make the switch?
okay. Either doctor, go right ahead.
Again, I'm sorry.
Yeah, I was gonna say, what's your opinion on.
No, I just think it depends on the child. When you think that they're ready, of course, by the time they're probably, I would say about 6, starting school, then they should be able to use a larger toothbrush. But I think it's strictly child dependent.
All right.
Just a real quick follow-up on that. There's like 30 million different designs of a toothbrush out there now. There's hard, soft, medium. Since you're general dentistry, Dr. Gray, what's your opinion just on a toothbrush, the best toothbrush generally?
I honestly don't know why they still make toothbrushes that aren't soft. I have patients that come in, they like to brush with a hard toothbrush and they brush really hard, and the only thing that does is damage the tooth. So I tell all my patients to only use a soft toothbrush or use an electric toothbrush. And you don't have to apply pressure. You just have to make sure that you're doing the motions.
Awesome. All right. Well, with that, we're going to give you all the rest of your evening back. Thank you again for your presentation, and we look forward to seeing you next month.